In this section, we shall be looking at septic arthritis. Arthritis is the inflammation of the joints from various causes. It could be polyarthritis, it could be monoarthritis. And when we say polyarthritis, we mean arthritis that's affecting more than one joint, whereas monoarthritis affects just one joint. Septic arthritis is an infectious condition characterized by the inflammation of a joint caused by the presence of a pathogen, most commonly bacteria, in the synovial fluid of the joint capsule. This condition results once bacteria invade the joint capsule and infect the synovial fluid. And this leads to very destructive states. These are bacteria. Septic arthritis is the most rapid and destructive joint disease. The incidence is around 2 to 10 per 100,000 in the general population and 30 to 70 per 100,000 in those with pre-existing joint diseases or those who had a joint replacement surgery. Septic arthritis is associated with significant morbidity and still has the mortality of about 10% despite advances in antimicrobial therapy. So people suffer from this condition, especially those who have had hip joint replacement surgeries, because surgery alone exposes you to pathogens. Then persons who are already having pre-existing conditions like diabetes that lower the immunity are much at risk of coming down with this condition. Generally, said that 2 to 10%, 2 to 10% among 100,000 will likely come down with septic arthritis. But the incidence increases from 30 to 70 in those who already have existing conditions that lower their immunity or who just had a replacement surgery. And it's one of the most destructive joint disease. The actual cause is bacterial invasion of the joint. Now let's look at the pathogenesis. Hematogenous spread refers to the dissemination of microorganisms through the bloodstream and the circulatory system to distant sites, which is a common route through which septic arthritis develop. That is, septic arthritis move through the bloodstream. Various bacteria such as Staphylococcus aureus, Streptococcus species, these microorganisms here, can enter the systemic circulation from infection in other parts of the body or regions. It could be from the skin. Maybe the skin integrity is lost, maybe for some skin diseases, or from the upper respiratory tract. So this could be the route through which these microorganisms can enter the body, Staphylococcus aureus, Streptococcus species. From there, they can migrate to the joint. Once the bacteria enters the bloodstream, that is, it's now what is known as septicemia. When it enters the blood, they can circulate and eventually seed into the synovial membrane lining the joint. The synovial membrane is a specialized epithelial layer that produces the synovial fluids that lubricate the joint and also nourishes the joint. The presence of the pathogen within this sterile environment of the synovial membrane leads to what is known as synovitis, that is, inflammation of the synovial membrane, which results to patient feeling pain, swelling, and inability to use that joint. So this is a normal joint, a healthy joint. See how sterile it is, and look at the synovial fluid and the capsule of the joint, enclosed articular surfaces, allowing free and normal movement of the joint. But here, it has been invaded by either Staphylococcus aureus or any other microorganism that can lead to septic arthritis. And look at how infected it is. At this point, this patient feels pain, and the shape of the joint is now being distorted, whereas the normal joint. Inflammatory processes are now occurring because of the presence of the microorganism. Inflammation will take place with pains. and loss of function. What are the risk factors for this septic arthritis? Several risk factors significantly increase the likelihood of developing this condition. One, increasing age. As individuals age, their immune response generally diminish. Yes, among older persons, their immunity is decreased. And also, as people age, there are changes in the skin integrity, that the protective part of the skin is lost, that the immunity there is reduced. And as well, the joint structures are therefore exposed to some of these infections or microorganisms that can easily lead to septic arthritis. Then, people who had pre-existing joint diseases, persons who have suffered from conditions like the rheumatoid arthritis already has a compromised structural integrity of the joint. And as such, their joint is highly exposed and can be easily attacked by these microbes. Because in rheumatoid arthritis, inflammatory changes lead to synovial hypertrophy, which alters the anatomical structure and biomechanics of the joint. The presence of the immune complexes and inflammations may predispose the joint to secondary infections, like I've said earlier. Because that joint has suffered a problem already, the integrity is lost. Additionally, a joint deformity associated with RA, that is rheumatoid arthritis, can cause skin integrity issues, making the skin a potential pathogen entry point. So when the joint has suffered arthritis, there's a lot of changes that have been done on that joint. As such, that joint can easily be infiltrated by microorganisms circulating in the blood. Another risk factor is being diabetic. People who have chronic hyperglycemia can have impaired immune functions, and as such, works on the skin integrity, which can lead to increased risk of infectious complications. Already, diabetes reduces the immunity of the body. The another risk factor is being immunosuppressed. People who are taking drugs that reduce their immune function, such as corticosteroids and chemotherapy for cancers, are at higher risk for developing septic arthritis because their immunity is down. Or persons who are suffering from HIV and AIDS or other malignancies like the cancers are likely to be in an immunosuppressed state. As such, are much likely to suffer from these conditions. As such, the body cannot mount effective inflammatory and immune response to infections. This increases their susceptibility to septic arthritis. Now, look at this joint. This joint is already fixing septic arthritis. Look at the microorganisms that have migrated to destroy this integrity. And this is the redness, the pain the patient passed through, and it can easily destroy this joint. Like noted earlier, it is one of the most destructive joint disease. It's very, very, very painful. Look at how red in this place is in the patient having the septic arthritis. Let's look at the clinical features. The usual presentation is with acute or sometimes subacute monoarthritis. That is one joint being affected at a time and with fever because it's of bacterial origin. The joint is usually swollen, like you saw earlier, hot and reddened, with pain even at rest. Unlike in OA, osteoarthritis, when you are resting, the pain reduces. And on movement, even while the person is resting and the person is movement, there's constant pain. Any part of the lower limb can be affected. The knee, the hip are the most commonly affected part. However, patients with pre-existing arthritis like OA, RA, that is osteoarthritis and rheumatoid arthritis, may present with multiple joint involvement. In adults, the most likely organism that causes septic arthritis is Staphylococcus aureus, especially among patients with rheumatoid arthritis, and those who are diabetics. In young people, that is, people who are sexually active, the common cause is the gonococcus, especially the decimated gonococcus infection, and with people who are with untreated gonorrhea. This usually presents with migratory arthralgia, a particular arthralgia with low-grade fever and tenosynovitis, which may present the development of oligo or monoarthritis, that is, one joint being inflamed. And also, it presents among these young people with painful pustular skin lesions to prove that it is of bacterial origin. This might also be seen. Then, among the elderly people, the common cause is the gram-negative bacilli, or group B, C, and G streptococci. They are the important cause among the elderly and also those who use intravenous drugs. So that is all we are going to look at about septic arthritis. So in this section, we briefly looked at what septic arthritis is all about, the cause, and we say it's of bacterial origin, when the bacteria infects the bloodstream and it can be disseminated through the blood to the joint. And when it has access to the joint, it attacks the synovial membrane. And when it enters the synovial, then it leads to inflammation, and the inflammation leads to destruction of the joint structure. That is all about septic arthritis. Another arthritis we're going to look at is the viral arthritis. The viral arthritis has an unusual presentation with acute polyarthritis following a febrile illness, which may be accompanied by a rash. Although we know viral infections are self-limited, and within 1 month to a month and 2 weeks, it should be able to resolve. So when there are some certain viral infections the persons may have, and they will come down with this arthritis, and that's known as viral arthritis. One of those viral infections is the human parvovirus arthropathy, that is the parvo B19 virus. It is the most common in Europe, and adults may not show the characteristic sign of that B19 virus, known as the slap cheek facial rash. But in children, you see the slap cheek facial rash in the children. So this bacteria is the this viral infection. When they affect the individual, they may actually lead to viral arthritis. So viral arthritis is common that is caused by a viral infection and is characterized by the joint inflammation. This condition can occur due to a variety of viruses like Shigella, parvovirus, B, hepatitis B, and C viruses, the regular viruses, among others. And the classical signs of viral arthritis is almost similar to that of the septic arthritis, such as joint pain known as arthralgia and swelling, then fluid around the joint known as. Then another sign is morning stiffness. Patients who are experiencing viral arthritis experience morning stiffness that lasts for less than 30 minutes and can improve with movement throughout the day, unlike that of septic arthritis that has constant pain both in the night and in the movement. Then also the person who is experiencing viral arthritis has systemic symptoms such as fever, malaise, fatigue, myalgia, and these are mainly due to the viral infection. They also present with rash, like I said, the slap cheek rash can be seen in children. The slap cheek rash can be seen in children. Unlike in adults, it may not be seen. So yeah, you might see the start rash among the children. Then additional symptoms the patient might actually face show up is um, uh, pain in the affected joint. Now, how does this particular viral infection occur? The pathophysiology of this virus begins when the virus enters into the body and finds its way to the synovial cell. This leads to inflammation of the synovial, and the immune response is initiated immediately with the recruitment of macrophages, dendritic cells, and pro-inflammatory cytokines such as the TNF alpha, the interleukin 1, and interleukin 6. This inflammatory response to that point will lead to synovitis, similar to what happens in septic arthritis. And that synovitis is the inflammation of the synovium. And this results to a serious destruction of the membrane. And other white blood cells will now infiltrate the joint. At times, this might lead to chronic inflammation, where the inflammation persists for a longer time. So that is how this particular viral arthritis occurs. So what is the management of both viral arthritis and septic arthritis? One, symptomatic treatment with the use of non-steroidal anti-inflammatory drugs. These drugs are used to relieve the pain and reduce the inflammation. And they work by inhibiting the cyclooxygenase pathway, as such, preventing the release of prostaglandin, which is important in inflammatory response. The corticosteroids are also used in severe inflammation when the NSAID, that non-steroidal anti-inflammatory drugs, are ineffective. We can use the corticosteroids to actually reduce inflammation. Then for that of the septic arthritis, antibacterial is used to kill the bacteria responsible for this. Then for that of the virus, the antiviral drugs is given. As for example, in certain cases of hepatitis B viruses, hepatitis viruses. Then another thing that is involved in the management is the physical therapy. Physical therapy may play an important role in maintaining the joint range of motion and muscle strength. So the person needs to engage in some level of exercise. Then patient education. The patient needs to be educated on the nature of the type of arthritis the patient is actually having, so that they will operate in the care. Then monitoring and follow-up is essential in the management of both viral arthritis and septic arthritis. They have similar presentation, but the cause differs. So that is all about septic arthritis and viral arthritis.